Hi, this is Dr. Coons, and I want to talk to you a little bit about documentation and testing when it comes to work comp injuries. When it comes to work comp injuries, never in any other type of injury that we have out there is it as important to get the testing done and show proper documentation and evidence that there has been an injury that you can point to a test and show that there's the problem. So I like to talk about the fact that we should have an x-ray done if it's spinal or involves bones, joints, and muscles. We should also consider range of motion devices like this one here, a dual inclinometer. Those can be really helpful in showing the limitations of motion. And if you look at the AMA guidelines, guidelines 3 and 4, these particular ones right here are the ones in the picture of the book. Another one is what we call surface electromyography, which is an example right here of what the surface electromyography would look like when doing the test. And there's these little modules like right here that show it's a very simple, easy, quick test that takes like less than 5 minutes. There's a little bit more in-depth one we can do called a dynamic electromyography unit, which shows us motion patterns and if your muscles are firing properly in those motion patterns. And then over here on the far side we have our kinetosense, which shows us not only range of motion but posture analysis. We can also do that with balance and also strength. So we can show that a muscle group is weaker, or that you have less balance, or that there's a problem that can easily be measured and then checked again 30 days later and checked again 30 days after that to show improvement. So if you're not getting these tests done, then we need to use some time to come into our office and let's do some of the testing. Let's get some of these tests to show the injury and get you on the proper time frame and proper treatment plan to get you better and back to work. Thanks a lot. Bye-bye.